by and large today, we've got a lot of really good news, and this is good news that should be celebrated by all North Dakotans because it's the work that you've been doing, the individual responsibility you've shown, the actions you've taken to slow the spread that are showing up in our numbers and giving us encouragement. I think Winston Churchill famously said one time when he was talking about World War II that this wasn't the end, but it was the beginning of the end. And I think when you hear the positive news that we have today across multiple areas, then you're going to understand that we can see a light at the end of the tunnel in terms of the end of the pandemic. And part of that is because of great work that all of you're doing, but it's also because we've got new tools in our toolkit. And today we're going to talk about those three powerful new tools that we didn't have 9 months ago. We didn't even have them really 2 months ago, but we have them today. And those three things, of course, we're going to talk about the vaccine and how that's going to be a super powerful tool in helping us end that. The second one is in an effort to reduce the mortality and save lives, a broader and more proactive use of the therapeutic solutions that are now available to help us save lives of those people that do become infected. And then the last thing to help us break the transmission chain is to more broadly use the Binax Now or the rapid testing in a way to not only help us get through the holiday season, but to help us get our kids back in school and keep our businesses open and running. And so we've got some very positive things happening. For us to kick off this morning, I want to start talking about some of the broadly some of these things that we're seeing, and of course, one of them which you've received news this week was and a lot of attention as it should because it was a historic week where the newly arrived COVID-19 vaccine from Pfizer being the first, and Moderna on its way. Expected to be here shortly. There's a second vaccine. But as you've read here, that healthcare workers from Stanford and CHI were among the first to receive the vaccine in Bismarck. Today, we've got two individuals that are going to be ready to receive their first doses of a 2-dose vaccine. And Molly Hall will provide an update on vaccine distribution, prioritization, and supply. And when we talk about the expanded use of the low-cost, rapid, and highly effective at identifying people who are infectious, the Binax Now tests, these are great because they give you a positive when someone's got a high viral load. We can identify people who are asymptomatic and pull them out of the transmission chain, and this is a way, low-cost, highly effective, quick way to break that transmission chain. And we have Dr. Josh Wynn will be giving the update on that. And then the third is this all of the exciting new therapeutics, which truly can be not only life-saving, but they have are demonstrating to have the potential to significantly reduce the need for hospitalization. So if you can reduce hospitalizations, that's great news for anyone who does not have COVID, but might be needing the highest level of medical care for stroke or heart attack or cancer or trauma, because again, we're managing our healthcare capacity for all disease tracks, not just for COVID. But Dr. Joan Connell will talk about that. And again, none of these tools, which are all three of these tools are super exciting, but it does not reduce the need for us to continue to be vigilant in terms of physically distancing, wearing masks, washing our hands, avoiding large gatherings, particularly as the holidays coming up, because transmission can occur in your home, around the dining room table, with family members as easily as it can at some other place like or work or in public. But there's two things that we know now that the virus doesn't like. The virus does not like ventilation. And we know from all the studies that there's less transmission when people are doing the same thing, say dining outside versus dining inside. But we're in a position in North Dakota where some of our outdoor activities are perhaps more limited, but still encourage people to think about avoiding places with poor ventilation and doing whatever you can to increase the ventilation where you are. The second thing, the virus cannot survive in places where there's distance between humans. So it doesn't like distance. So again, as you head into the holidays, be aware and be alert that at places that have got large crowds of people unmasked in poorly ventilated locations, that should set an alarm for you that that's an area where there's much more likely to be transmission. And if you're in some place where you've got great ventilation and distance, you're likely quite safe. So this is the safety factors vary, but you as an individual can make the choices of how you want to spend your holidays to make sure that you're protecting yourself, your family, your family members, those that are vulnerable, our healthcare workers and others in the community.